How's everyone this morning? Good. I'm glad you're here. I'm glad you're here. My name is Jackie Lana Lindsay, and I am the Education Coordinator for the Alzheimer's Association. And I want to thank each and every one of you for being here this morning. And I hope the presentation gives you a lot of insight or just reaffirm things that you already knew and encourage you to help others if you are able to see some signs of Alzheimer's disease or other dementias. First of all, before we get started, I just wanted to mention to you that the Alzheimer's Association and TCC have come together to partner together for what we call AEDA, which is Alzheimer's Early Detection Alliance. It is important to get an early diagnosis if you suspect yourself or someone of having the disease. The reason being, it enables that individual to be able to live a longer, higher quality of life. Not only that, a lot of times when we think about memory loss and people's minds go towards, do I have Alzheimer's disease? It could be something else that's going on. And if you're fearful and won't get an early diagnosis or find out what's going on, then it could have been something that could have been easily prevented. And so with this partnership that we have, we're in the future going to be having future presentations on the topic of caregiver care, how to get help, a lot of different topics that will better assure you that there is help, there's resources out there, I'm not alone, and so we're looking forward to a very prosperous future working together. If you have any additional questions of when other presentations will be held, you're welcome to ask Debbie Filmer in the back, and she'll be delighted to help you. All right, are there any questions before I get started? All right, well again, thanks for being here. The title of our presentation is it Alzheimer's or is it just normal aging? Sometimes we can get very confused. If we hear too much about Alzheimer's, then we think every little something could be Alzheimer's, and it's not. So we're going to move on, and one of the things that I always want people to know is what are the objectives? What do we want to cover today? What am I going to learn? So they have an idea of where we're going. So one of the things is important to understand the facts of the disease. Another one is to understand the difference between Alzheimer's and dementia. And then to understand how the brain works. A lot of times if we can figure out what's going on in the brain or understand what's happening there, then it helps us to be able to care for our loved ones and people we know with the disease a lot better. So we're going to talk about the brain. And what are the signs? What am I looking for? Okay? What should I take seriously and what's okay and it's just a part of normal aging? And then, how is Alzheimer's disease different from normal aging? So these are the subjects we're going to be covering. Now, let's start off with dementia. One of the things I always hear people that will say, oh, my mother had Alzheimer's, but thank goodness it wasn't dementia. And then there are people that will say, oh, my grandfather had dementia, but thank goodness it wasn't Alzheimer's. So what we want to do is just clear up the difference between the two so we can better understand what's going on. So as you can see up here, it says, what is dementia? The loss of memory and other intellectual abilities serious enough to interfere with daily life. Well, what does that mean? It just means that dementia is the symptoms of a disease. And what we want to know is, what disease is it? See, dementia brings on symptoms of loss of memory, reasoning difficulty, language problems, ability to make proper decisions. It could affect our balance. It could affect our mood. And so with these sudden changes, then it is important for us not to jump to a conclusion that it's Alzheimer's disease, but really figure out, with help from physicians, what is it exactly? Because if we get an early detection, we can change whatever the course of the disease may be. All right, so we're looking at what is dementia. One of the things about dementia is that there are over 70 different types of dementia out there. Alzheimer's is just one of them. I had the opportunity to hear one person do a presentation, and they said that there were over 99 different types of diseases. Okay, and I went, 99 different types of dementia? Oh my goodness. Well, as long as I say over 70, I'm included in that number. So we'll stick with that, over 70 different types of dementia. And Alzheimer's being one of them. As a matter of fact, most of the time, 70% of the time, it will be Alzheimer's disease. Now, what are the different types of dementia? Well, we could look at it like this. If I was to mention to you flower and ask you, what type of flower do you like? What would you say? Rose. What would you say? Rose? Oh, okay. 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 What type of flower do you like? Okay, I understand. Okay. What's your favorite flower? Carnation. Say yourself. Lily. Daisy. Carnation. Carnation. Rose. Okay, now did you notice that there were a lot of different types of flowers mentioned? They're all flowers, but they grow differently, they smell differently, you care for them differently, but they're all under the heading of flower. And that's the way dementia is. There are different types. Some are reversible, some are not. Some have dire consequences, others do not. Some of the symptoms and signs are different, but they all fall under the category of dementia. And when we talk about dementia, we're talking about vascular dementia, mixed dementia, Parkinson's disease, dementia with Lewy bodies, physical injury to the brain can bring on the onset of dementia. How many of you are bicycle riders? Ah, the important question, do we use a helmet? Very good, okay. And then for everyone else, do you still drive? Okay, do you use a seatbelt? Okay, I saw a little funny, no. Well, it's important to always wear a seatbelt because if there is an injury and the injury happens to the head in later years, it could develop into a type of dementia. Okay, so making sure that we protect our head. We have to do that with what we have in our home. We can all have lovely throw rugs. Anyone have throw rugs in your home? Okay, well they can be a death trap or injury trap if they're not secured, if they're not used in a proper way, if we end up putting cords underneath the rug so to hide the cords and all. These are potential injuries to the brain that can happen if we fall. So we have to be careful to make sure that that doesn't happen. All right, then there's Huntington's disease, frontotemporal dementia, normal pressure hydrocephalus, mild cognitive impairment, Alzheimer's disease. Now I said 70, but we don't have enough time to go through all 70 of them. But I will tell you this, that with normal pressure hydrocephalus, even though it's one of those that can have long-term effect, if it is diagnosed early, it can be reversed. And those symptoms that come with it will deteriorate and disappear. So it is important for us to know what is treatable and what's not. Treatable, poor nutrition. Well, let's just say there's a senior with poor nutrition. How can we change that? How can we change the poor nutrition? Pardon me? Eat right, exactly. And then the symptoms will go away. Just imagine, you're a senior, you're not eating correctly, you're beginning to have symptoms of dementia, and what you end up being diagnosed with because of your age and dementia symptoms is Alzheimer's. And it's not. All you have to do is just start eating correctly, and the symptoms would disappear. Then, in some cases, you can have a thyroid deficiency. Medication combinations. When we don't tell our physician all the medications we're on, and we're taking what they give us, what another doctor gives us, and what we take over the counter, and some herbal treatments, and all of a sudden, someone is saying, why are you so forgetful? Why is your attitude like that? You know, why aren't you able to what's going on with you? And so we might be quick to say that what the problem is that, oh, maybe I have Alzheimer's disease. Okay, and it's not the problem. The problem is the medications. So we can get the medications adjusted, lowered, eliminate some, and the symptoms of dementia would leave. Fluctuating blood sugar, that could be an issue. We mentioned normal pressure hydrocephalus. We take the water, have the surgery, get the water off the brain, and then the symptoms of the disease change. Dehydration. Anyone ever see the commercial where the man is in the desert and he needs water, and all of a sudden he sees the palm trees and it's an oasis and he crawls there, then starts drinking what he thinks is water and it turns out to be sand? Hallucinations. That could cause dehydration, okay? He's already dehydrated, okay? What do we need to do to hydrate him? Drink water, okay? But without the water, then the hallucinations continue, the symptoms of dementia are still present. And we have the same thing that happens with the aging, because as we grow older, seniors tend to not drink as much water, and that becomes a problem. Okay, so we have to make sure they're staying hydrated. Lung disease, cancer, depression. Who would ever want to be on Aricept, which is one of the Alzheimer's drugs, if all you had was dementia, and because of they're looking at the symptoms, they put you on Alzheimer's drugs? That would be terrible, when all you have to do is just get an early diagnosis of what's going on, what the changes are, and you could prevent the depression, or at least have medication, okay, and solve whatever's going on. An infection. Who would want to have an infection and be diagnosed with Alzheimer's? That's terrible. If you get the early diagnosis, you find out it's just an infection, the symptoms go away, and then you continue to live your life. Anemia, same as anemia. So it's very important for us to get that early diagnosis. Okay, let's talk some more about Alzheimer's disease. It is a progressive brain disorder that gradually destroys brain cells and affects a person's memory, ability to learn, make judgment, communicate, and carry out basic daily activities. Alzheimer's disease is not normal aging. It is progressive, it is fatal, and there is no cure. Facts about Alzheimer's disease. There are over 5.4 million Americans with the disease. And every 69 seconds, that number increases. And if we don't find a cure by the year 2050, there are going to be over 16 million Americans with the disease. And we're going to be saying every 33 seconds, someone develops Alzheimer's disease. Now, most people consider Alzheimer's as something seniors get. But you can be as young as 30 and less than 65 and develop Alzheimer's disease. In fact, over 500,000 Americans, and that number is increasing, have Alzheimer's disease right now. Normal process of Alzheimer's disease, it usually lasts from 3 to 20 years. That's a large range, but it depends on the individual themselves, okay, at where that average is, or how long that they will live with it. Something else to keep in mind, are there any baby boomers in here? Okay. Without a cure, 10 million of us are going to develop Alzheimer's disease. At 65, 10% of the population will develop Alzheimer's disease. At 85, 50% of us will develop Alzheimer's disease. Look at your neighbor. Just look at your neighbor. Let's assume we're 85. One of you will develop Alzheimer's disease without a cure. Okay, it's hard to accept, but those are the facts, and that's why we need people that volunteer for clinical trials. That's why we need the researchers to continue doing research for the cure. Because without researchers in their labs doing what they do, we can't come up with it. And then if they do come up with something, it takes volunteers to do the testing, the clinical trials, before the FDA will approve it. Causes and the risk. Let's talk about risk factors. There are some things that we can do something about, and then there are other things that we have no control of at all. Age. That is something we can't do anything about. I know that because I love to try and dye all the gray hair away, and guess what happens? It comes back, okay? Or try the wrinkle cream, the anti-wrinkle cream. You can see through the wrinkles. So I have learned that aging is going to happen regardless of what. Nothing I can do about it. Another one is family history. How many of you have family in here? Okay, don't be shy. Okay, everybody has family. Okay, now this one you can be shy about answering. How many of you wish some of your family members were in somebody else's family? Okay, all right, okay. But you realize you can't do anything about that either, right? They're in your family, there's nothing you can do about it. All right, so we accept that fact. We have to accept the fact of heredity. Head injury, if it's happens on a regular basis, how severe it is, in later years you'll see the results of having had that head injury. Now think about professional football players or boxers, okay? They have increased their chances dramatically. So we always have to protect our head. One of the things that we can do something about is our heart-head connection. What it has to do with being involved in healthy eating, healthy living, taking care of ourselves. There is the opportunity that we can reduce our chances of developing the disease. Now, what does that really mean? Well, for those of us who might have hypertension, might have diabetes, might have an overweight problem, might have cholesterol problems, we have increased our chances of developing the disease. Now, to put us at equal level with someone that does not have any of those, then whatever the doctor has instructed you to do as far as watching your weight, watching your cholesterol, keeping your blood sugar in normal range, making sure your blood pressure stays in normal range, and you're taking the medications. If you're doing that, you're on equal level with anyone else. Now, some of the things that you have to do in addition is make sure you're eating the right foods, okay? Make sure you're getting plenty of antioxidants and omega-3 fatty acids. Make sure that you're reducing the amount of sugar that you're taking. How many of us like cookies? Okay, love to have the cookies or the cakes or the pies. Well, I wouldn't dare say, don't eat any of that, okay, because it wouldn't last. You'd be back on it anyway, so I wouldn't tell you that. But what I would say is if you could just reduce the amount of cookies and donuts and all of those things you know are already wrong, so I don't have to go through it, and increase the level of foods that are good for you. You know, spinach, green leafy vegetables. You know, we all know. It's just a matter of our choices, what we choose to eat. But if we choose healthier foods, we can reduce our chances of developing the disease. If we make a decision to exercise, anybody love to run? Any runners in here? Okay, any walkers in here? All right. Okay, so if you're walking, how far do you walk? Depends? Okay, on average. Probably 3 blocks. 3 blocks. Okay. Okay, all right, but that's good. That's good. My advice when we're talking about reducing our chances of developing the disease and being healthier is to increase that amount because your body gets used to a certain amount of exercises. So you're always wanting to challenge it. So even if you're eating healthy, your body has become accustomed to some of the foods that you eat. So increase the amount of foods that are good for you. So that's another way to be able to help. And then for those that are very creative, reading, love to read a lot, or do artwork, or some form of mental stimulation. Increase that, okay, wherever you are. If you're not doing anything, then start doing something, okay? But the idea is to increase it. And socialization, go out, be a mentor, okay? Be a part of a group where you're interacting, just like we're interacting here. The more you do that, the more you decrease your chances of developing Alzheimer's disease. And if you do all 4 of them, you have made changes in all 4 areas, you have decreased your chances of developing the disease. But is that a guarantee? No, it's not. You've just done your part, okay? So keep that in mind. All right then, moving right along. Alzheimer's is progressive cell failure. And then as a result of that, we have death. Now this is a beautiful brain. And I wanted to talk about the brain before we start talking about the signs of the disease. Because if you understand what that brain does, you understand what's going on when Alzheimer's starts. Now here, the brain is responsible for sight, sound, smells, for making plans, for movement, for memory, thought, solving problems. A healthy brain does that. And a healthy brain doing that makes a big difference in what we're able to do in our everyday life. Now, life becomes interrupted if things change. Here on the left, you see a normal human brain. On the right, a brain that has Alzheimer's disease. The brain on the right has developed cell death. Cells that are in the brain die. And with the death, you end up seeing more deaths or curves and open parts of the brain. That's because the cells are beginning to die. Okay. Well, here we go. Alzheimer's destroys brain cells. Our brains have 100 billion brain cells in them, and they interact with each other. It causes one to think, to smell. Just like if I was thirsty, then I would say, I'm thirsty. I wonder where I can get some water. If I see where I can get some water, then I go over there and I do what's necessary to have the water. That's because these cells are interconnected to each other, and it leads from one thought to the other. When Alzheimer's develops, there becomes a disconnect for that continual thought process stops, and you can't think of what you were going to do or what you were going to say or how to be able to do certain things as a result of cells beginning to die. Now, these are healthy nerve cells. And here's a close-up of even more healthy nerve cells that are interconnecting with each other. One of the things that I want you to think of is my hand being a nerve cell, okay? On the outside of it, we'll say this is the cell membrane. The skin would be the cell membrane. What happens in Alzheimer's disease is that there is what you call APP, amyloid precursor proteins. It's like the little hairs on the back of your hand that stick out, okay, on the cell membrane. That's the skin part. And they're sticking out like that. There is an enzyme, they're called beta secretase and gamma secretase, that will cut the APP that's on your hair. And so that part that's cut, it starts floating in the brain. It's called beta amyloid, sorry. They're called beta amyloids. And what those loose particles do, they become a sticky protein-type substance. So just imagine if you have a lot of cuts going on and they're sticky, they start massing themselves together. And as a result of that, you see the lower part mass and the middle part and the upper part, those are amyloid plaques. We call those plaques. That's where you have a lot of that cutting going on. And it ends up separating those brain cells. So brain cells that were Once connecting like this, that mass called plaque kind of separates them like this. And whatever process they were normally able to do, they're no longer able to do because there is a disconnect. Now, the second thing that happens, looking at my hand and pretending it's the inside of a cell, the inside of a cell would have what you call microtubes that are running from the insides of the cell to other cells. And they're supplying, you see the lines that they're, okay. Well, these lines will be the microtubes. Let's pretend that. And if they're connecting to other cells, then it's transporting foods and nutrients that it needs and supplies that it needs. Well, what happens is that there is what you call spacer tau. And these towels help keep the microtubes together. And something happens and they start falling apart, which means these nice lines break apart and become tangled. Okay, and these fibrils become tangles. And what tau becomes is another word, tangles. And that black spot up there is a tangle where the cell has died from the inside out. Okay, so what you have is death to a cell from the inside out, and then you have the mass called plaque that divides the cell and causes cell death. So all of these are the symptoms that you would see in a person with Alzheimer's disease. Let's see, I would have liked to have gone back to, let's see. Let me see if I can go back here. Okay, right there. That's what I wanted to go to. If you look at the left brain here, what you're going to see is a normal brain, a normal human brain. To the right, you have an infant brain. Now, notice the difference is a lot smaller and it's not as active, okay? Then you have the Alzheimer's brain in the middle. The Alzheimer's brain is smaller, okay? And it looks more like an infant brain than it does the adult brain. The reason being is, remember I talked about all those cells that were dying? Okay, well, you don't have as much activity in the Alzheimer's brain. So one of the things to keep in mind is the brain shrinks, okay? It's not active. In fact, it's more like the infant brain. The difference is with an infant brain, you can train them. You can train them to talk, to walk, to think, to make reasoning. Okay, that's part of the normal growth cycle, and that's okay. Where people miss it is when they think of an Alzheimer's person, they can do the same thing. If I just keep telling them, they'll get it, okay? If I keep repeating myself, they'll remember, all right? If I keep challenging their brain, they'll learn new information, but that doesn't happen. They don't have the capacity to do it, as demonstrated here. So when you can see this, it will help you to recognize that, oh, I can't expect them to remember and to know things they used to know. It causes you to be more compassionate because you know what's not there. It's literally not there. It's died. Those cells have died. So that means I have to no longer try and make them live in my reality, but I have to accept them in the reality that they're in. So if they think a certain way, I have to accept it and not try and make them change to my thinking. What happens when you try and make a person change and think differently, a person with Alzheimer's disease? You will get frustrated, they will get frustrated, and the person who really is going to dig in their heels is the person with the disease, all right? Because that's all they know. Even though you know what's right and wrong, the mere fact they only see it one way, they're going to stick with that thinking. So to keep peace and calm and contentment in the home, with the family, with the relatives or friends that you know, you agree to disagree with them, okay? What's more important is for them to be content in the state that they're in, all right? It will keep a lot of frustration down. So I want you to keep this in mind so you don't forget this particular picture that you saw. All right, well, let's talk about some of the signs of Alzheimer's disease. It says here, memory changes that disrupt daily life. Well, with Alzheimer's, the disease starts with short-term memory loss. So I have a question for everyone. How many of you remember what you had for lunch last Tuesday? No one's raising their hand? No one's raising their hand? Well, the good news is that's not Alzheimer's, okay? All right. Now, if I was to ask you, what did you have for breakfast this morning? Could you tell me? Okay. Now, with Alzheimer's, they probably couldn't tell you what they had for breakfast. With Alzheimer's disease, even if nighttime came, they would never remember. Now, in the beginning, they might, but as the disease progresses, they will not be able to tell you that. In their mind, it never happened. Any short-term memory. Okay? Now, we can all get busy, forget an appointment or a schedule, or you meet a person once and don't remember them. That's not the disease. It's recently learned facts that should be right there. Being here is a good example. You go home this evening and your loved one asks you, well, how was that presentation you attended at TCC? What presentation? You know, they were talking about Alzheimer's disease. I didn't have a presentation to go to. There wasn't a presentation, and you're adamant. It's not like it comes back to your remembrance later. You are persuaded that it never happened, okay? That's something you would be concerned about. Let's look at challenges in planning and solving problems. How many of you on your jobs have to solve problems, do planning? Okay. Well, some of our planning may only take 10 minutes to do, okay? And you've had the same type of planning for the last 2 or 3 years, and 10 minutes, that's all you need. Well, now that planning takes an hour, okay? You can't seem to get it together. Okay, your mind sways, you get distracted. And I don't mean I need this report or I need something else. I'm just saying you just normally can't seem to get it together. It's just taking you time. Outside situations are not affecting your ability. It's what's going on here that's causing you to take a lot more time to be able to figure out how to complete a plan. All right, our problem solve. Are there some people in here who are problem solvers? Okay, normally solving a problem is what you do, no problems at all. Now it becomes a challenge, okay? You're not quite sure what the answer is. Even though you might have given the same answer hundreds of times in the past, now you can't make a decision. Now you'd rather someone else make the decision, solve the problem. This is something that you would be concerned about, okay? These are just, and it doesn't happen overnight. It's a gradual process where more and more you're having challenges. Anytime anything happens suddenly, that's probably not Alzheimer's disease, because Alzheimer's is progressive. It's progressive, it gets worse and worse, okay? So if you just think you've taken some new medication and all of a sudden the next day you can't think, can't remember anything, you're having problems with balance, and you go through all the signs of Alzheimer's, oh gosh, I'm having all these signs. That's not Alzheimer's, it's probably something else going on, okay? All right, difficulty completing familiar tasks. How many of you ever walked into a room and forgot why you walked in there? Okay, all right, the good news is that's not Alzheimer's disease, okay? Because 9 times out of 10, you can just kind of back yourself out, okay, rethink your steps, okay, or even work on something else, and then by the time you work on something else, oh yeah, now I know what I want, and I just go in the room and take care of it. Okay, that's normal. You're in the right place. You're fine. What you should be concerned about if in this same situation, let's just say that for the last 10 years, you get up and you make breakfast at 6 o'clock, you go in the kitchen to prepare breakfast, you go into the kitchen this particular day, and you can't figure out what you're supposed to be doing. Okay, you know breakfast, but what is breakfast? Okay, what does it entail? You've just kind of forgotten, okay? It's just not there, but it's a regular routine. It's familiar to you, And now this task that you've always been able to do, you now need help. What am I supposed to be doing with the eggs? I know I'm supposed to get, it's just difficult trying to get it together. Make the toast. All right? That's something. That's a familiar routine, a familiar task that you're no longer able to do. So you can relate that and correlate it to work or anything. But that's some of what's happened. Something you've always been able to do, can't seem to do it now. Confusion with time or place. Now, one of the things when we're working with a person that has Alzheimer's, we have to be very careful that if we're going to tell them that, oh, we're going to the park on the weekend and it's Wednesday. If they have Alzheimer's disease, then in the next few minutes, they may ask you that again, and may ask you, when are we going? Are we going to the park? And you said, well, remember I said we'd go on the weekend, okay? So 15 minutes later, they ask you that same question again. Remember I said the weekend, Saturday, we'll do it on Saturday. Oh, okay. And then a little later, they do the same thing again, all right? Their ability to understand time and what that means between Wednesday and Saturday has been disrupted. So the best thing to do if they're asking every 15 minutes, you got it down to a fine art. They always ask me something every 15 minutes. Well, 15 minutes before you actually go to the park, then you tell them, okay? So there has to be an adjustment on your part, not their part, on your part. Okay, another thing with time. Let's just say that you have always been able to understand time, what time is it, and you have someone that's constantly asking you, what time is it? Now, is that because they have forgotten what time it is? It could be that they've forgotten what you said. They're having a problem with understanding the time on the wall, or so they ask you to be sure. Sometimes they ask a question about time is because they anticipate doing something at a particular time, and it hasn't happened. So you start asking what time is it. Say they like to listen to the news at 12 o'clock, and you got kind of busy and you forgot and didn't turn on the TV or anything, and now the constant, they may not be able to ask, hey, it's 12 o'clock, I should be watching the news. So what comes out of their mouths is, what time is it? Okay, so you have to know the person to know what they normally do at a particular time. That could be it. Or it could be if they know if they ask what time it is, you're going to respond. And they're bored, and to get you to interact with them, they'll ask that because at least they'll get a response. So what we have to do is redirect when that situation happens. Now, sometimes getting confused about where they are becomes an issue. Now, when I was trying to come here, I was trying to remember, okay, what street is Metro on, and about when I have to make another turn. Okay, a place, that's different. I'm trying to orient myself. Let's just say that I have lived in the same house for 10 years, worked at the same job 10 years, and I'm on my way to work. Now, if I've done this, I should know my way to work. But in this particular instance, I get halfway to work, and suddenly nothing's familiar, not sure where to go, where I should turn, where I should get off, probably not even know why I'm even on the interstate if I'm on there, okay? All of a sudden, everything just goes blank. The same could happen when you're walking in your community, and you've been doing that for I don't know how long, in the same area. And all of a sudden, you're halfway there. You can't identify your house. You can't identify the other houses. You don't know which direction you need to go to get back home. You're just there wondering what's going on. These are some of the things that you might realize there's a problem and need help with. Trouble understanding visual images. Well, that one situation would be this. There was a lady who was 86 years old who lived at home, and she called 911 because there was someone in her home. So the police came out and they did a search of her home and didn't find anybody. On the way out, she was in the hallway directing the policeman out, and there was a mirror on the wall, and she looked at it. There she is, there's the stranger. It was her reflection in the mirror that she didn't recognize, okay? So who she is different in her mind than who she is naturally. So she sees herself as being a lot younger than what she actually is. That's one thing to be concerned about. A person with the disease, you will find out if you put a black rug in front of a door, that's a good thing if you don't want them to go outside that door. Okay? If it's just a rug in your house, they may interpret it, a black rug, they may interpret it as a hole. That's the way they see it, and they'll walk around it. Or if you have a beautiful, shiny floor, well waxed, and it appears to them to be wet, and they won't walk on it. Are they having problems with steps, being able to understand how they should step to go up to the next step? And they'll just look at it and probably won't attempt it. These are some of the visual cueing, visual images that they would probably have a problem with. Distances become a problem or situation. Sometimes even colors become a problem. How to really be able to interpret these colors. Okay. Another thing would be problems with speech. Could you pass me your plate right there? Or plate, right? Can I have your plate? I can't have your plate? I'll give it back. Okay. I can't have your plate? Okay. She doesn't know it. I just graded her F as caregiver. Okay. One of the things there you go. There you go. One of the things that start happening is their language, words that they use, may not be the correct words. But the idea is, if you know what they're talking about, just give it to them. Because what I was doing with her, yeah, that's a plate, you know. Yeah, I mean, she was just, no, you're not gonna have it, okay? But if I asked for a handout, she would know what I'm talking about and pass it to me, okay? So what we do, depending on the stage of the disease, if it's the beginning stages, and maybe I call it a plate, she may say, oh, you mean this handout? And I went, oh yeah, that's what I want, and she give it to me. But if she's gotten to the point, I've gotten to the point in the stage of the disease that, no, it's not a handout, it's a plate. Then you know, go along with them. Don't try and correct them, because they'll be anxious, they'll get frustrated, your blood pressure go up, and I'm still saying it's a plate, okay? What have we really learned? Nothing, okay? What we learn is that we have to live in their world, and living in their world means if that's the way they see it, that's the way it is. The only time you're really concerned about changing things if it's going to harm them or people around them. Now, me calling that a plate is not going to harm anyone, but it will bring contentment. And that word that I might use may turn into a sentence of words that don't make sense, or a paragraph, or a whole language of things that doesn't make sense. But does that mean we cannot communicate anymore? No, it doesn't mean that. We can still communicate with them. Sometimes if they have a second language, they'll start speaking their native tongue. And then you go, well, gosh, if they get to the point I can't understand them, then we're going to have problems. I'm going to have to put them in long-term care or something because I can't interpret what they're saying. That's not true. It's not true for the mere fact that language, speech, is only 7% of communication. 55% of communication is body language. 38% is voice tone and facial expression. How many of you have ever had a pet or have a pet? Raise your hand. Okay, let's exclude parakeets, okay? Okay, we're not going to include them. How many of your pets you could understand when they wanted something? Okay. When you had a command or instructions for them, how many of them could understand you? Did they speak English? Okay, all right. Well, if we could understand pets, how much more can we understand our loved ones or people we know? We just have to start looking at things from their perspective, knowing their history, knowing their habits, their likes, their dislikes. That can bring on the facial commandment. What, you're Susan? Susan, I love you.
Well, I love you too.
But did you believe that? Knowing the person. Okay, but if you didn't know the person?
If I did?
If you did not know the person? Okay. It's not about what we say, it's how we say it. Okay, and you have to remember that, because when you're caring for someone, they could say things in very strange ways. But if you know the heart of what they're trying to say, what is the meaning behind what is being said? Okay? So that we have to keep in mind. All right? All right.
I have a question.
Uh-huh.
So if somebody is like has a stroke,
Okay.
now, can that cause Alzheimer's? Or is that just
Stroke is in the vascular dementia area. Now, I'm going to try and watch my hands, because normally I'd put the mic down and do this. Okay, Alzheimer's is like this, gradually. Okay. Stroke is like this. You're fine, you have a stroke, you get on medication, then you're like that. Okay? Then if you get off your medication, something happens, then you go down again, but get on the medication in the hospital and it smooths itself out. Okay? Stroke can be controlled, even though you may start losing some of your memory, you don't get everything back, but you can become stable and keep going. Alzheimer's, it's going to go down, and it's under vascular dementia. Okay. All right. Now, misplacing things. Anybody ever misplaced their car keys? Anybody? Okay. All right. Well, guess what? That's not Alzheimer's disease, all right? Now, if those car keys end up in the refrigerator all the time, that would be something we might be concerned about. And then we go into the refrigerator and the keys are there and think nothing of it and grab the container of water or milk and leave the keys in there. That might be something you might want to consider as a problem, all right? Even if you have 3 keys on a key ring, office key, home key, car key, and now you can identify what they're for. These are some things where we would have concern, but not just misplacing the key, because 9 times out of 10, if you backtrack yourself, you'll find it, all right? And then let's just say you don't find it that day, and then you're looking at something else. Here are my keys. I was looking for those things yesterday. That's okay, all right? But when they constantly come up missing, and the key man is making all the money because you keep replacing them, okay, that's something to be concerned about. All right, decrease or poor judgment. Last week, there were several warnings, thunder, and it's going to rain, and put up your patio furniture, and things like that they kept telling you, right? Okay, did any of you all heed that or really take it seriously? Anybody just ignore it and say it probably wouldn't happen? Okay, we have one that ignored it. Okay, now that's poor judgment. But it's not Alzheimer's, okay? It's not Alzheimer's disease. A lot of times when the weatherman tells us certain things are going to happen and it just seems bizarre that it would happen, and we ignore them, say, okay, if it happens, poor judgment. Oh, we made the wrong decision. But if we're talking about a person that decides to put on an overcoat, boots, gloves, in 100-degree weather and go outside and think nothing of it, that's poor judgment too, okay? And that's something to be concerned about. And they don't feel anything's wrong with it, okay? That would be poor judgment. Or you have the telemarketer that calls or someone calls and says, you just won $1 million. If you just put in a certain account, 100,000, we'll put the 900,000 in your bank account. If you fall for that, something could be wrong. Maybe you're just trusting and want to believe them one time. If it happens second time, definitely something wrong with that, okay? So we have to be very careful and look at that being the difference. Poor decision making, poor judgment. Anybody know anyone who's the life of the party? When you have a social gathering, when you have meetings at work, you can expect them to liven up the place. How many of y'all know somebody like that? Okay. Well, pretend this person now is not so lively. He doesn't liven up the place. He's become withdrawn. He or she has become very withdrawn. That could mean something if, depending on how long it lasts. We're all in a bad mood, don't want to be bothered at times. Sometimes things are going on in our lives that causes us to kind of withdraw. But then there are those that withdraw with no apparent reason, and it's continuous, and it becomes obvious, and they can't explain it, and they don't even recognize it's happening. That would be a concern, okay, where you would want to investigate. Changes in mood and personality. Well, a person that, anybody ever gotten on the interstate, going to work in the morning, you're in a good mood going to work. You get on the interstate and that mood changes, okay? You get off the interstate and then your mood's fine. But then you see the detours and then your mood changes again, all right? Then you get to work and you're okay, fine, you're not late, you're in a great mood. The first thing you hear is your boss want to talk to you. Well, that mood could change too, okay? Then if you get a pink slip, then that mood has definitely changed. Lots of different moods and changes, right? But you can explain it. There's a reason. That's not Alzheimer's. If the mood and attitude changes without explanation, from sad to happy to mean to fearful to anxious, and there's no explanation for it, and they can't explain it, something's going on. Sometimes with the disease, they're just fearful. And being fearful, you might find an independent person who doesn't need anybody, now dependent on your opinion, on what you think, on being with you, on following you around, fearful. Something is changing in them, that they're not secure in themselves. Okay, that would be a concern. So if you hear of this or see this, it's important to get a diagnosis. And in getting a diagnosis, let's just say we take your loved one to the doctor. Say, doctor, my aunt, she's 80 years old and we're having memory problems, and I really believe that something's going on. I think she has Alzheimer's. What do you think, doc? And the doctor says, yes, given her age and memory loss, she probably has Alzheimer's. You know what you do? Thank you, doctor. And take your loved one out of there, okay? Because it's more to it than just, age, 80, memory loss, must be Alzheimer's. They need a complete workup from a complete lab workup, history workup, medical workup, okay, probably a PET scan, an MRI, a CAT scan, a mental status exam, visit a neurologist, a psychologist, and what we do is what we call exclusion. We want to exclude the fact it was just depression. We want to exclude the fact that it was just dehydration. And when they have excluded all these different things and the only thing left on the table is Alzheimer's, it probably is. With Alzheimer's, you can be 90 to 95% accurate in a diagnosis. To be 100%, what do you think needs to happen? Autopsy. That's the way to be 100%. But when you find out what the disease is, it is important to contact us, the Alzheimer's Association, get help, let your family know, make adjustments in finances and who's responsible for documents in your home. These are the things that need to be done. Now let's talk about the difference. Someone with Alzheimer's forgets whole experiences. Someone with normal age-related changes forgets parts of the experience. Someone with Alzheimer's rarely remembers later. Someone with normal age-related changes often remembers later. Then someone with Alzheimer's is gradually unable to follow written, spoken directions. Someone with normal aging can usually follow written and spoken directions. Someone with Alzheimer's gradually is unable to use notes. Someone that's in the process of just normal age-related changes is usually able to use notes. Someone with Alzheimer's is gradually unable to care for themselves. Someone is just in the aging process, they can care for themselves. Normal brain aging, taking longer to learn or remember information. Having difficulty paying attention or concentrating in the midst of distractions. Forgetting such basics as an anniversary or names of friends. Needs more reminders or memory cues such as prominent appointments, calendars, reminder notes. Although they may need some assistance, older people without a mental disorder retain their ability to do errands, handle money, find their way to familiar areas, and behave appropriately. So in the aging process, even though they may not be quite as sharp as they used to be, they're still able to take care of themselves. Okay? All right. Symptoms to be concerned about: lack of awareness that you have forgotten something, forgetting recently learned information, memory loss that interferes with daily life, unable to follow written or spoken directions. Let me say something about this. A lot of times people talk and you're sitting there looking at them, and if you're not concentrating and you're thinking about your roast at home, they may say something that you really didn't hear, okay? And then they ask you about it and you say, I don't remember that. And that's not Alzheimer's, okay? We're talking about information you have actually received, okay, and tried to retain. And then after trying to retain it and everything, it's just gone in a minute. That's different, okay? So we have to understand that. Are there any questions about what has been discussed? No questions? All right, well, I want to thank you for allowing me to come and speak to you. My time's up, and I thank you for yours.